Okay, good evening, everyone. Thanks for joining us for our second Careers in Paediatrics webinar. Last week we spoke mostly about the recruitment application process, and this week we're going to hear from a selection of paediatricians. We're still hoping to not have as many technical issues as last week with everyone on, but we have got certainly 3 people lined up. And we're going to kick off with Dr. Emma Coombe, who's one of our current trainees. We'll also be hearing from Dr. Rachel Mitchell, who is a new consultant, and hopefully we'll also hear from Dr. Eamon Majdabadi, who has just been selected and appointed into paediatric training to start in September. And if we're very lucky, our Officer of Recruitment, Simon Broughton, will also join us at the end, and we'll hopefully be able to have a sort of 10-15 minutes questions and so on. So I think we'll get started now, and I will hand over to Emma Coombe, who will give us a bit of a rundown of her career so far and what it's like in training. Just bear with me, Emma, while I unmute you.
Evening, can you hear me?
Hi. Okay.
Hello. So welcome all to this careers webinar. My name's Dr. Emma. I'm currently an ST5 trainee in paediatrics. I've been asked to talk to you this evening about my career path so far in paediatrics, but really that's just as a springboard for us to have a conversation about all of the things that you would like to ask us about as paediatric doctors. So please do use the live Q&A to ask questions as we go along, and James, our careers manager, will be keeping an eye on those and hopefully helping to answer those as we go. And you know, really it can be any aspect of a career in paediatrics or applying to paediatrics that you can ask about this evening. So I'll start by telling you how I ended up in medical school in the first place. I originally didn't know I wanted to be a doctor when I was doing A-levels. I actually thought I wanted to be a marine biologist. I quite fancied the idea of sitting on the back of a dinghy out in the sunshine, tagging whales and dolphins and having a lovely time. And then I came to read the university prospectus for marine biology. And it was all about seaweed and algae, and I thought, oh my goodness, what am I going to do with these science A-levels now? And I asked my teachers, what can I do? Shall I be a science teacher? And they said, absolutely not. Have you thought about a career in medicine? And I was really lucky that at the time Peninsula Medical School had recently opened. So I went to school in Torbay down in Devon, and the then Peninsula Medical School was situated in Plymouth, Exeter. Obviously it's now separated into those 2 separate medical schools. And I was successful in applying to a place there, and I really enjoyed the course. It was quite a modern medicine course. It was a PBL based course, and I really enjoyed that we were clinical right from the first year at Peninsula. We had lots of involvement out in the community, and then in the hospitals in Plymouth and Exeter and Torbay, Barnstaple and Truro. And what I found whilst I was at medical school was the aspects of the work that I liked most were working in a team, working with a lot of variety, so lots of different conditions. I liked having a breadth of patients to work with. Holistic medicine, I really enjoyed general practice because you got to treat the whole person. But I didn't particularly like working on my own, and although as a GP you do work with a lot of other professionals, they're not in the same room as you, and I'm a complete extrovert and I really enjoy the company of lots of other people, so I really liked working in the hospital because you got to work in a really big team. And I was at sixth form actually. I took a job in a children's nursery in a holiday park, and I kept up that job whilst I was at university. And so when it came to doing our paediatric placements, in which were in Peninsula predominantly in the 3rd and 4th year of medical school, I found that I was just a bit more comfortable being around children and families. And obviously at medical school, a huge part of the undergraduate curriculum is very adult focused, and that can make a lot of people put off by considering paediatrics as a career, I think, because you automatically veer towards the things you're more comfortable with, and you just don't get the same level of experience in paediatrics at medical school as you do with adults. So I think my holiday job in the creche definitely gave me a head start and meant I was more comfortable, perhaps, talking in a language that kids would understand, understanding the challenges of parenthood, even though I wasn't a parent myself. And so I was one of the lucky ones, I think. I know a lot of medical students, when they come to the end of medical school at the moment, don't really have a clue what specialty they'd like to go into. And that's an amazing opportunity, but it's also a challenge, because it's hard then to tailor what you do in your foundation years in order to help build your portfolio and CV. But the brilliant thing about paediatrics is that you don't have to be a person like me who knows that they want to do paediatrics from medical school. So the paediatric recruitment process is designed not to disadvantage you if you haven't had any paediatric experience in your foundation years. So you can do things like quality improvement projects, audits, and even extracurricular activities that aren't related to medicine at all to evidence your transferable skills to demonstrate why you would make a good paediatrician. So I stayed in the Peninsula for my foundation years. I did choose to do a foundation post in paediatrics, but it was my first ever F1 job. So I was very supernumerary. I didn't really get given a lot of autonomy, and I was very protected. And it was a fantastic learning environment, and the doctors and nurses that I worked with were brilliant, and I had an absolutely great time. And that cemented for me that paediatrics was the field that I wanted to go into. And then I spent quite a few frustrated months rotating through adult specialties, some of which, I knew weren't going to be particularly relevant for a career in paediatrics. But I tell you what, on reflection, they absolutely were, because my general surgical job taught me about looking after surgical patients, and that's something I still do now as a paediatrician. Even though I'm not a paediatric surgeon, I'm involved in shared care of children who have operations, and I look after them pre and post surgery with the surgeons. So that's come in handy, knowing about the post-op management of patients. I did a general practice job, so that was really interesting to see the GP perspective, because as paediatricians we work a huge amount with general practice. I think a quarter of a GP's patients are under 18 in terms of the number of patient contacts that they have a year, so we work really closely with them, and we rely a lot on them to integrate the care, because we know that for children and families they would much prefer to be looked after in a place that's close to them and their home. So our GP colleagues really help with that, and understanding what the working life of a GP is like really helps me be a better paediatrician. I did rotations in adult intensive care, and obviously children need intensive care too. So since working in paediatrics, I've done rotations in natal intensive care, and I'm about to start working in a paediatric intensive care in September, and there'll be transferable skills there in terms of the way that we look after patients using like an A to E systematic approach, working with lots of other specialists, working in that intensive care environment. And I did some general medicine jobs too. My respiratory job taught me how to do chest drains, for example, and that's still a skill that I use today looking after children. So don't be frustrated if you don't get a foundation post in paediatrics. There is transferable skills to be had everywhere you look. It's really common these days to do an F3 year, isn't it? I didn't take a year out between my F2 and applying for specialty training, because I thought, well, I know what I want to do. I might as well crack on with it. And I thought, I've done my medical school and my foundation years in the same place. I should probably look to branch out a little bit more, so that not all of my career is in the same region, because we know that practice can differ from place to place in the UK, and so it's useful to have a variety of experience from which to draw upon. So I applied for my paediatric training to start in Wales, and I successfully got allocated to a post to South Wales and started my first ST1 in Cardiff, and I did a year of general paediatrics, which I absolutely loved. But my story is one that really demonstrates the flexibility of the paediatric training program, because I only did 1 year in paediatrics training before an opportunity came up to do an outer program year. One of my consultants tapped me on the back and said, "Oh, I've heard about these leadership fellow jobs. You're really into quality improvement. I think you should apply." And I thought, well, what on earth is an ST1 going to do in a leadership job? But she really encouraged me to apply, and I thought, well, I've got nothing to lose. And I ended up getting one of these posts. And so I took a year out of paediatric training, essentially project managing a big trust level project at the University Hospital for Wales, and it was about safe staffing levels for paediatric services. So it had a paediatric focus, and I had paediatric consultants mentoring me and managing me. But it was a really great opportunity because I was also supported to undertake a postgraduate certificate in leadership and management, which the hospital funded, and I was able to fly over to States, went to Boston to visit the Institute for Healthcare Improvement, and I was able to attend international health improvement conferences to share the work that I'd done. And that has since opened so many doors to things that I do alongside paediatrics now later on in my career. So then I went back into training. I did my first year in a neonatal job. I really like neonates. It's quite a different environment from paediatrics, and some people see it as a Marmite, you love it or you hate it. I did love it, but I don't think I could do it forever as a job. I've, through my training, established I think I want to be a general paediatrician. I definitely found the skills useful that I've gained in neonatal medicine, and as a general paediatrician I'll still be looking after babies from the day they're born. If they go home from hospital and come back in, it'll be looking after them, so those skills are invaluable, and I will take a lot from those rotations. Did my ST4 year, my ST3 and ST4 years, and then I took another year out in order to undertake a clinical teaching fellowship, and again that was an opportunity to get a funded postgraduate certificate in medical education. I was able to spend 50% of my time teaching undergraduate medicine at the University of Bristol, so I just taught the paediatric block because it had been a long time by that time since I had done adults, and again really fantastic opportunity to incorporate teaching with clinical paediatrics. And I had a brilliant time, and the skills I learned during that year I'll take with me for the rest of my career. So now I'm back in training. I am on my third out program year on what's called an OOP-T, so this one counts for training. I've come out of my region to South London, and I'm currently undertaking a 6-month fellowship in paediatric emergency medicine, with a side interest in ambulatory care. Unfortunately, that has been a little bit disrupted by COVID, but I have learned so much, again, by coming to a different region, and learning a different way of doing things, and learning from the way paediatricians work elsewhere. The other thing I want to mention about my career so far is the fact that paediatrics has allowed me to work less than full time, without necessarily needing help or a caring responsibility. So I'm a category 2 less than full-time trainee, but now in paediatrics you can apply to work less than for any reason, and that's because we recognise that when doctors are allowed to work the hours that they would prefer to work, that's better for retention and morale, and in the end that's got to be better for our patients. So for the last 18 months I've worked 80% of full time, and that has enabled me to carry on some of my side interests. So now that I have got those skills in leadership and management and medical education, I put them to use in my other interests. So I'm a representative for junior doctors within the BMA. I represent the junior doctors in the Severn region, and attend the National Junior Doctors Committee on their behalf. And I also represent paediatric trainees in the National RCPCH Trainees Committee. And within that committee, we have representatives for different regions, but we also have representatives for certain different roles. So, for example, there's a representative for exams and assessments, there's a representative for e-portfolio, there's a representative for less than full-time trainees, there's a representative who links in with the European Associations of Paediatrics. And I happen to be the representative for recruitment and careers, which is why I'm here today. So I work with the rest of the Paediatric Trainees Committee to feed into the Royal College of Paediatrics what is the voice of paediatric trainees. And we're really lucky that our college really pays attention to what we as trainees think. And you really feel that you have influence and that the college is listening. So, for example, a lot of our paediatric trainee reps were saying recently that they felt strongly that the college should make a statement around schools and support schools to reopen as the lockdown after coronavirus eases. We've all recognised the sacrifices that children have made, you know, their free will, their education, their well-being, in order to in the main protect adults. And you'll see today in the news that the Royal College of Paediatrics has released a letter that has been signed already by 1,500 paediatricians to that effect. So I think it's really brilliant to be part of that community of paediatricians. And I think another thing that sets the Royal College of Paediatrics apart is that it's not just the Royal College of Paediatricians, like you might see the Royal College of Psychiatrists or the Royal College of Surgeons. We are the Royal College of Paediatrics and Child Health. It's not exclusively about doctors. We are about representing the needs of the child health workforce, doctors and all of our other allied healthcare professionals, but also the interests of children. And I think that's a really great thing. I've been talking for too long now, so I'm going to hand over, I think, is it to Eamon next? Hopefully Eamon's on the line.
Yeah, thank you very much, Emma, that's great. Great to hear.
Thanks, I can't wait to hear your questions.
We are going to hand over to Eamon now. Now, unfortunately, his camera's not working, so I'm going to pop the slide back up there so Emma doesn't have to sit there in awkward silence. But yeah, Eamon, as I think I mentioned earlier, is a brand new trainee, so he's due to start in September. So yeah, I'll let him have a chat now about what he's experienced so far.
Thanks, James. Can you hear me okay?
Yeah, a little bit quiet, so I don't know if you can. I'll just get a bit close to the microphone. Or.
Hi everyone, thanks for that, Emma and James. I'm Eamon, as James just said. I am an F3 currently at King's College Hospital, and I am starting PEDS ST1 in London come September. I've been asked to talk a little bit about my route into paediatrics and specifically how I found the application process, which feels like a very long time ago after everything that's happened in the last few months, but was only a few months ago. I fell in love with paediatrics really in medical school. I went through the early part of my clinical years and the preclinical years not really knowing what I wanted to do, and then I came across my PEDS rotation, and all of the regs and the consultants I came across with, they were the happiest doctors, they were the most willing to teach, they were the most engaged with their patients, they saw the sickest patients when they first came in, but they also dealt with all of the other things, the community care, the parents and schools, and I just remember thinking, this is the sort of doctor I want to be. This is the specialty for me. I had my head turned a little bit. I loved my A&E F2 placement, so I ended up doing an F3 in paediatric A&E to see if I really love paediatrics that much, or whether it was just the acute side of it. And as well as you can tell, since I applied and accepted the offer, I absolutely loved it. Loved working in that busy environment and seeing the kids as they were coming through in a whole range of conditions, and decided to step down the paediatric route. So the application is via Oriel, which I'm sure most of you are familiar with through the foundation program. It starts the beginning of November and runs for the whole of November before closing towards the end. There's then the shortlisting process, which is announced in early January, with invites for face-to-face interviews in January and February, and then offers come out in early March. The Oriel application, I found it very long and tedious. So my first tip is to give yourself the time to do it in several goes. You're not going to be able to sit down and do it in one evening. Most of it is the basic information that you kind of expect: your name, your qualifications, your additional degrees, your employment histories, references, all of that sort of thing. But it does take a little bit of time to go through. You can also rank your program choices at this stage, and quite a few of the deaneries and schools around the country are starting to give you a little bit of early choice as to, so you can see exactly which programs, which specialties, which rotations that you want to do. So I was mostly looking at London programs, and I was able to compare the different jobs and different rotations all across London and see all of them, which took a little bit of time to go through, but definitely would have preferred it that way rather than just being sort of lumped into an area and not knowing what I was getting into. The main section of the oral application, which takes a little bit of time, is the white space answers. These are about a couple of 100 words each, and basically have to try and sell yourself as much as possible in order to go through to the interview stage. And if you're anything like me and hate blowing your own trumpet, I found it quite difficult to do. They cover a range of things: your clinical experience, audit, management, academic achievements, and teaching. And then an additional section at the end that for anything you didn't cover in the other sections. Good place to start for this is the person specification on the Royal College website. This is a list of the essential and desirable criteria, the sort of things they're looking for in the paediatric ST1 applicants, and this is trying to go through and tick off where you've shown evidence of all of these sort of things, where you've shown evidence of teaching or quality improvement and those sort of things is quite a good starting point. The other thing I would advise is to try and get as many different people to read through it and try and give you feedback. Paediatric registrars and SHOs who have recently gone through the process. I gave mine to a couple of non-medical people as well, who are more used to writing CVs and cover letters and those sort of things than medics are, which I found quite useful in sort of changing some of the language and trying to big things up a little bit. Then you go on to January, where hopefully you're shortlisted and given a interview date. The interviews rotate different places around the country. I think they're in the major cities so that no one has to travel too far to get to them. And it's a station-based interview. So the interviews are made up of 5 stations initially. So everyone comes in, registers, and goes to the prescribing station to start with. You're given a blank drug chart and given 10 minutes to fill it in with, well, I had a couple of drugs to fill in with a copy of the children's BNF. Relatively straightforward, not looking to catch you out, and if you've had a couple of practices with it, should be absolutely fine. The other stations were face-to-face, rotating through different rooms with 2 panelists in each room and a various topic or activity in each room. Generally, the interview was a lot less scary and a lot less stressful than I first anticipated and from what I'd heard from colleagues doing other specialties. The paediatricians were sticking to the stereotype and very friendly, not looking to catch you out at all, and were generally prompting you and trying to move you in the right direction the whole way through to try and get the very best out of you. And it was really quite nice feeling the whole way through. Everyone will have a communication station, very similar to the sort of things you have done in medical school, OSCEs, where you will have an actor who has something paediatric based to ask you, be it a parent who's worried about a new drug or a parent who's asking about a procedure, but nothing should be beyond the competencies and abilities of someone at F2 level there, and sticking to the same sort of things have been taught in medical school. So checking their understanding, open questions, asking if they'd understood anything, asking if they had any questions, all those sort of things got me through that one pretty well. And again, the actor was very friendly and prompted me the whole way through the station. There's a governance station talking about different aspects of clinical governance. They will take you through a pretend clinical scenario, again, something paediatric based, but relevant for and understandable for someone who just completed foundation training, and ask you to go through the different issues and processes that you would need to go through in those situations before asking you to reflect on a case yourself. If you could make that case paediatric based, then great, but I don't think there were any additional marks for making it a paediatric specific issue. It was more about the process. Do you know who to escalate things to? Do you know what you need to do immediately and what can wait a few days before you act on? How do you do things in sort of short term, medium term, and long term? There is a book which is called the medical interviews book for SHOs and registrars. That pretty much takes you through the whole process for those sort of questions. Third, there is a clinical case station where, again, slightly PEDS based, but okay for anyone who's done F1 and F2. The way I approached this one was to work through sort of an A to E scenario, then talking about what I would do in the short term, what management I needed to do for the patient, who I would escalate to, what were the next investigations and steps I needed to take, whether I wanted to admit the patient. Again, very friendly and prompting you if they think something's on the tip of your tongue, but not quite getting there. And then finally, the portfolio station. The portfolio you have to put together is 12 sides maximum, not like some specialties where you are have reams and reams of paper. Takes a little bit of time to cut and pick the things that you want to put in there. So I would advise starting as early as possible for that. But it's really the opportunity to sell yourself and show, like the white space questions, why you're the ideal candidate, why you want to do paediatrics. One of the interviewers will flick through the portfolio while the other will ask you the more stereotypical interview questions. Why you want to do paediatrics? Who, what qualities make a good paediatrician, etc. The whole process, as I've said a few times, was really encouraging, really friendly. Don't go into it being scared. Go into it ready to smile and show all the great things you've done, and I'm sure you'll have absolutely great time like I did.
That's great. Thanks ever so much, Eamon. It's good to hear experience of somebody who's literally just been through the process. We've got a few questions popping up as well. I've answered a couple in the chat, but we will come back to most of them hopefully, and there's certainly one there which will be for you about what you found most daunting about the process, maybe the application form, as you've already mentioned. The next person we're going to hear from, or the last person we're going to hear from, is Rachel Mitchell. So I'm just going to pop Rachel up for you now. So Rachel is a new consultant. She works down in King's, and she's going to tell you a bit about how she's got where she has.
Hi everybody, thank you very much for asking me to speak today. So as James has just said, I've been a consultant for just over a year now at King's in South London. I've been a paediatric trainee in London prior to that, and did my foundation training in South London. So I do have a self-confessed London slant, but hopefully a lot of what I say is going to be quite applicable to everybody from across the country. So I thought I wanted to do PEDS when I was at medical school, and then I did a foundation job in PEDS, and it kind of confirmed it to me. I applied through a process about 10 years ago now, and it was a very similar process actually to what exists today, which is, I guess, quite reassuring, hopefully. So there is definitely benefit in talking to people who've been through the process, even if it was a while ago. At the time I first applied, I thought I wanted to specialise in paediatric oncology. So when I ranked all my jobs, I made sure that I had a paediatric oncology job as an SHO. But very quickly during my my ST1 year, I realised actually I was most at home doing acute paediatrics in the paediatric emergency department. And really that's where the rest of my PEDS career has been focused on mainly. I then did a range of placements, including the paediatric oncology placements, neonates, my core registrar years, and then I applied to the grid and did paediatric emergency medicine as a subspeciality. I don't know if anyone, if you're aware of what the grid is, but essentially at SD4-5 level, you can decide whether or not you want to subspecialise into a particular subspeciality. And so for me, I chose paediatric emergency medicine. We, as paediatricians, like to think of general paediatrics as a subspeciality. So if you don't decide to do what might be thought of as a more traditional subspeciality, you would remain in the general paediatrics route. And probably, James will know the figures better than me, but probably 2/3 maybe of people stay as a general paediatrician, and about 1/3 of people decide to subspecialise. And for me, I subspecialised in paediatric emergency medicine. I then, in the last few years of my training, did placements just around that. And throughout my training, and similar to Emma, I was lucky enough to be involved in a number of other things. So I took time out of training to do a DARSI fellowship, where I got a management and leadership qualification, and learned lots about quality improvements, and found that really, really useful. I also was on the Royal College Trainees Committee and our local trainees committee in London. And I loved education all the way through my training, so I was always highly involved. And whilst I loved all the placements that I did, actually for me what made my training so great was the other stuff I did alongside it. I think it made me feel like I was a bit more in control, and was able to influence things a bit more. So yes, at times it meant I was giving up a bit of my free time to do it, but I found it really complemented the clinical side of things that I did, and I wouldn't have had it any other way. So then I was getting to the end of my training and realised that actually I was I was going to need to look for a consultant job. And one lovely thing about paediatrics is that you're on this lovely, I guess you can call it lovely, this conveyor belt, if you like, of run-through training, which means that unless you decide to apply to a subspeciality, you have a job from ST1 all the way through to when you finish. And lots of people come off the conveyor belt at various points to do different out-of-programme experiences, as you've heard. But the nice thing is there is that knowledge that you will always have that job. And when you get to the end, that isn't there anymore. You have to then go out and look for a job. There are lots and lots of consultant jobs out there, so don't be scared. You will get a consultant job, but it's just not. It's actually like looking for a proper job in the real world, if you like, where you have to actually go and think about what you want to be, where you might want to work, what you might want your job to look like, and you have to go and talk to people and do this awful thing called network, where it actually feels very excruciating, especially as a paediatrician. We're all very nice and don't like kind of putting ourselves out there and trying to find out if anyone might give you a job. So the process is quite different to the subspeciality or your ST1 application, but everyone has to do it, and it works out in the end. I was particularly keen to look for a job that allowed me to do other things because I enjoyed them during my training. I wanted to make sure that I worked with good colleagues, because these were going to potentially be colleagues for a long period of time, unlike the kind of 6 or 12 month rotations I've been doing previously. And because I'd done paediatric emergency medicine as my subspeciality, I wanted to be doing a lot of that. And so a lot of the planning was around talking to people and what my job plan might look like and how it was going to work. And I had one job interview before I got my locum consultant job at King's, and then and that was for a year. And then I was appointed substantive in December, which means a permanent job essentially. So now I don't, in theory, have to look for another job again, which is a lovely prospect. Just very briefly, just to tell you about how a consultant job plan works, it's slightly different to your normal rotas, but they are generally quite flexible, and they are divided up into sessions. A full-time job is 10 sessions a week. And because you will inevitably do a bit of out of hours work, evenings, weekends, it often means you don't work 5 days a week. So my full-time work is 4 days a week plus 9 weekends a year. And actually that's very nice, and feels very much more manageable than the shift system of being a paediatric trainee. You also have time allocated in that for your own development and any projects you might be doing, which is nice. So in theory, I'll have a day a week to do that. And you do educational supervision in that time. I also lead the education programme in our department too, and get to do lots of service improvement stuff. So there's lots and lots of flexibility as a paediatric consultant, and I have to say life is really great as a paediatric consultant, and I'm really enjoying it. I definitely enjoyed my training, but I have to say when you get to the end, it gets even better, I would say. The other, I guess, just a couple of things to touch on as well. I'm actually currently on maternity leave, so I have a almost 4-month-old, and my first baby. It's been totally fine me being on maternity leave as a consultant, and I think it's fair to say that as paediatricians, we're very, very accommodating of people who want to go off on maternity leave or need to go off maternity leave during their training, and so that's something which I think if you're at all worried about coming into the specialty, is very, very normal. So please don't see that as a negative. Actually, it just means that it's just part. I think everyone understands that it's part of being a lady, I guess, if you want to have kids, and it won't be at all detrimental to your training. And then I guess the other thing I wanted to talk about was, I guess, maybe my worries when I was going to be a consultant, because you get to the end of your training and you think, hold on a second, am I really ready to be a consultant? I've been in this process for so long and I've always had somebody to ask. And so am I going to know what to do when the buck essentially stops with me? And I guess the answer to that is, on the whole, yes, I have known what to do, because I think your training equips you really, really well for being a consultant. But the few times when I have thought, hold on a second, I'm not sure, I can still phone a friend. And I think that's really important to say, that when you get to the end of your training, however long it takes you and whatever you do during the way, paediatrics is a specialty, which means that you are always going to be supported, and having lots and lots of lovely consultant colleagues means that you are always going to have people that you can ask. So I've never felt that I've been on my own, and I think that's something which is really important. The other final thing, I guess, was what do you do about all the management-y stuff that comes with being a consultant? Because you learn all the clinical stuff during your training, but how do you prepare yourself for all of that kind of thing? So answering complaints, risk, if you've heard of that as a concept, governance, all of that kind of stuff. And I guess part of that is getting involved in those kind of things during your training towards the end. But again, actually, as a relatively new consultant, I've been supported in writing reports. I've been supported in getting involved in all of that kind of thing. So again, it's been that's been really nice, and I've never just been left in the lurch to get on with things. So I guess my summary would be that I've had a great training experience, and as a new consultant, I felt very supported, and I don't think I'm alone in that. Yes, I work in a really great place, but I think the same is true for a lot of people. There are also schemes, so Stepping Up is something which is college endorsed, which looks at helping people make that step from registrar to consultant, and so it's something which I hope people will not feel too worried about. I'm going to stop there because I know there's lots of questions from people that people want to ask.
That's great, Rachel. Thanks ever so much. We'll just bring everyone else back in there. Yeah, there's been quite a few questions coming through. I've tried to sort of group them and publish like the main themes of them. So I thought if we could try and sort of work through a vaguely sort of chronological order. So if I can get Eamon back on, I was going to ask him about application. I'm just going to pop a slide up as well, which has got just some links and some places where you can find out more information there, various sort of websites and documents and so on, which is all very useful for anybody that's looking to apply to paediatrics. But yeah, the first question I was going to go with, I think Eamon should be back with us now. Yeah, one of the questions was, what did you find the most tricky thing about your application this year to paediatrics?
Probably the preparing for the portfolio station, not because it was not because anyone was out to trick me or because the interviewers were particularly harsh. It was probably the one thing that I'm the least comfortable with. Naturally, it required a little bit of training and to venturing outside my comfort zone to practice not only just listening to the sort of things I'd done, but trying to sell them in a positive way. I don't think that we get a lot of training in that, whereas other jobs and other careers sort of told to, you know, how to sell the things you've done, how the projects you've managed, the extra things you've done in your own spare time, which I'm sure that everyone has got, but just being able to word those in a way of like, and this is why I make a good paediatrician, I found quite difficult. But as I've said several times now, the interviews were really encouraging and really good at coaxing that information out at you. So I wouldn't worry too much about that.
Yeah, well, another question that somebody's asked about the portfolio station is kind of how it's scored as well and what sort of things go into it. I mean, as you say, I think one of the things about the way that portfolio station is set up is certainly so that people are given the opportunity to score in all the various areas that are on the interviewer's score sheet. You can sort of basically get an idea of almost exactly what the questions are from the applicant guide every year as well. So hopefully that is something that people find helpful for that, and the reflective practice station as well. And it's deliberately a very open thing because of the sort of varying level of experience that people have in paediatrics in medical school and foundation. So it kind of covers another question that somebody asked about whether you'd be sort of at a disadvantage if you haven't done an F3 year or something. So the fact that we're very aware of this sort of disparity in experience and opportunity that people get means that you really shouldn't be, because we're trying to interview everybody on a sort of level playing field, really. I don't know if Emma or Rachel want to come in on that at all.
Yeah, well, what I said is I don't think you do need to have done F3, because we're more looking at the skills and attributes rather than necessarily your particular achievements. And also just think about how all of the things that you've done outside of paediatrics have those transferable skills that you can demonstrate. Think about the person specification when you are progressing through your F1 and F2, and think about what activities you can undertake during your foundation years to help demonstrate that you meet that person specification by the end of F2, and you'll absolutely be competitive.
Yeah, and somebody's asked whether you need to sort of include various courses and stuff in there, and actually you can, but actually I think the sort of thing we try and recommend every year is actually that people put things in there that will allow them to have a sort of an interesting and animated conversation with the assessors and actually really put themselves across as being somebody that's going to be a great paediatrician. You know, we're basically looking for people who understand what paediatrics is like, how to do it well, and to show us that they're really keen and they're going to be a really good one. So yeah, by all means include probably sort of courses and so on, but equally you're not probably going to have the most exciting 10-minute conversation about the 10 courses you've been on. Yeah, and as Emma says, try and think of other transferable skills and things that you can cover in there by using slightly more creative sort of methods, I suppose. And
somebody's also asked if you can include things that you've done during your time at medical school, and I think you can, absolutely, because they're all part of the journey that you've been on, and you know, you've taken those skills and experiences with you. So yeah, definitely, and think outside the box. It doesn't have to be medical. You can include something from your personal life. It might be a hobby that you do, or a charity that you volunteer for, or some other activity completely unrelated to medicine that you think gives you something that will be the makings of a great paediatrician. So absolutely show us the person you are as well as the doctor you are.
No, absolutely. And if you want to look back at the last one of these webinars we did, you'll see the list of sort of attributes that we think make a really good paediatrician that we're looking for when we interview. So, you know, have a look through them and sort of see what things you can use from, yeah, not necessarily even medical things that you've done, sort of leadership skills and team working skills in particular. Plenty of ways you can sort of demonstrate that. So yeah, there's another question there about, someone's asked about sort of fast tracking, and also someone who's been in GP as well, and asking where you'd end up starting. They've also got the diploma in child health. ST1 entry and fast tracking is something we introduced a couple of years ago, but just to say, and I think I popped it in the published question chat, it's not assessed anymore as part of the interview process. By all means, log if you've got 12 months there in advance, and we've basically left it so that when you start your training post, it's a conversation to have with your supervisor. It may be that people actually, when they start training, think, no, I'd really love to do all of it, so you know, I don't necessarily want to fast track. So we thought we'd sort of, it's quite a hard thing to assess anyway, but you've still got the opportunity there essentially to use prior experience if you've got 12 months or more. But it's not assessed anymore. It's something to register on your application form that gets forwarded through to your deanery. So yeah, a conversation when you start training. And from a sort of GP training sort of point of view, currently we don't have sort of transferable skills, unfortunately, directly from curriculum to curriculum. And DCH will be a good thing, I'm sure, to talk about interview, to sort of pop on your portfolio and so on and so forth. But unfortunately, it wouldn't be something that would be counted as sort of additional or anything that would immediately start you at a higher ST level, essentially. I'm just thinking there was another question very similar to that as well, that was about, let me just see if I can find it. Yeah, marking criteria for the application form. So somebody's rightly pointed out, some of the other specialties do have like a scoring criteria for applications. We try and interview everybody, so we don't do that. There is a shortlisting scoring criteria there, which we don't tend to use, but if we ever had so many applicants that we didn't have spaces to interview them, then we would. So that is there, and it gives you an idea of the sort of things to focus on, certainly. I don't know if anyone else wants to say anything about sort of application form content from that point of view.
I guess there's one thing to say, that actually, as I said, the content and the scoring is very similar year on year. So if you know that you want to do paediatrics, you can actually be looking at it in advance and think, what kind of things could I be doing? Where can I get those boxes ticked to help your form? Saying that though, paediatrics is not the most competitive of specialties, as we've said, and what we wouldn't want people to go away thinking is that they need to go and do lots and lots of different things. Actually, if you want to be a paediatrician, you can demonstrate that you have those attributes from a person specification. It's not about having done huge PhDs or huge big projects. It's about having the right personal skills, and that's what we aim to bring out in the interview and the application form. No,
absolutely. Somebody's asked about deferred entry and whether you can actually defer entry for paediatrics. Currently, it does have to be for statutory reasons, so I suppose that's a fairly straightforward answer. Interview rounds, as with all the other specialties, are sort of counted as separate things. So, you know, if you apply one year and then find you actually can't start that year, you would need to apply again in the following year. So just I suppose just think carefully about sort of when you feel ready to take up the training and so on. And just bear in mind now that you do get a little bit of reward if you do end up working outside training for another year, for example. And that's the sort of fast tracking idea. In that, you know, if you do end up spending a bit more time and then go away and do some paediatric work for that year, then that could easily sort of help you move through training a little bit quicker when you get there. There's a very specific emergency medicine one, which I think only Rachel can answer, really. It's asking actually what are the pros and cons of either coming in through the paediatric training pathway or the emergency pathway to get into paediatric emergency medicine.
So I guess the simple answer is that there's no right or wrong answer there. I think it depends whether really you want your long-term career to be treating adults or not. In the scheme of things, your training is actually relatively short, and your consultant career is going to be what you're doing for much longer. And so I would, if you're considering both, I would think about what the consultant job of an emergency medicine consultant versus a paediatric consultant looks like, because actually that will probably influence which route you go down. If you do paediatric emergency medicine through the paediatrics route, then your last couple of years of training are pure emergency medicine, and you do all the same rotations as a peds trainee prior to that. If you do emergency medicine, then you do mostly adult emergency medicine, and then you have 1 year of subspecialty training in paediatrics. So the routes to get into them are very different. In theory, you could be working in the same job at the end, but it's quite rare for people in emergency medicine to just do paediatrics. Often they will have a mixed job where they do a bit of both. So I would have a think about whether you want to be treating adults or not. And I think that was what Eamon was thinking about when he was deciding whether or not to go through the adult route or the paediatrics route. And that can hopefully help you decide. I'm very happy if anyone wants to talk to me separately about that. James, if you want to give anyone my email address, that's totally fine.
Okay, great. Thank you very much. Yeah, we'll just a couple more. I think we'll try and sort of finish about 7ish. Somebody's asked. We've had some questions about working out program again. So I don't know if anyone wants to say anything more about that, because I know you've done quite a few different bits and bobs.
Yeah, what type of things can you do? Are these opportunities common? I would say that you don't have to just consider opportunities that are open to paediatric trainees. So both of the out of programme years that I have done have been open to trainees of any specialties, and these opportunities are often there when you go looking for them, but they don't necessarily fall in your lap. So things like keeping an eye out on NHS jobs is a good idea, but also just talking to colleagues and senior trainees where you work. That's how I got my first UP, is my consultant tapped me on the shoulder and said, oh, I've heard of this job. I think you'd be interested in it. And I wouldn't necessarily have sought that opportunity out for myself. So making your colleagues aware of your interests means that, you know, they will come and find you when they see an opportunity like that. I also think that Twitter has been a really good aspect for me professionally. So my current out of programme opportunity, I saw first of all a consultant posted a link to the job advert on Twitter, and I think people are using social media more and more in that way. So yeah, just keeping your eyes and ears open for out of programme opportunities. And the world is your oyster. I know colleagues that you know, have gone abroad with MSF. They've taken years out to do research. They've had a year out for a career break because they felt they needed a pause in their training. The opportunities are endless.
No, absolutely, yes. Okay, so I think that probably covers the main themes of the sort of questions that have come through. If anybody ever has any other questions, as Rachel said, we're more than happy to answer them. You can certainly contact us at the college. If you look on the Choose Paediatrics pages, you'll be able to see the email addresses for both my team, the recruitment and careers team, and also for the careers campaign inbox as well. So, you know, keep a lookout for the sort of Choose Paediatrics stuff, which will be coming around again very soon as well, as we build up towards the recruitment process for next year. Just to say as well, I mean, as with last week, just a slight caveat on. We've been telling you very much about how the interviews run at the moment, but quite clearly with everything else that's going on at the moment, things may change a little bit. But I think the one thing we can guarantee is that we will still be assessing the same things and looking for the same attributes, you know, and so therefore that stipulation to have a certain amount of experience and so on and so forth, that still won't be a prerequisite. So take exactly what Emma and others have said this evening about that as the thing to start thinking about. But unless anybody else on the presenting team has anything to say, I think we'll sign off this evening, and thanks ever so much to everyone that's joined us. Thank you.
Thank
Take care.